One of the most exciting studies at ICML this year, which was in the plenary session, is a study of Tazemetostat, which is an inhibitor of EZH2. Several years ago, investigators discovered that EZH2 is a relatively frequent driving mutation in follicular lymphoma and in germinal center diffuse large B-cell lymphoma. It's present in a minority of cases, but a significant minority, about a fifth of patients have this. And Tazemetostat is an inhibitor of mutated EZH2. The makers of Tazemetostat conducted an international phase 2 study assessing the role of this drug in mutated and unmutated diffuse large B-cell lymphoma and follicular lymphoma, and preliminary results were presented at the plenary session this year. It's an exciting study because it's an example of a drug which has a good rationale for its use. We have really exciting story about the development of and the discovery of EZH2 mutation in the preclinical setting, the discovery of the agent several years ago, and then emergence of this agent in the clinic. And the first piece of information that Frank Morchauser, the primary author, was able to present was that this is a well-tolerated drug. I'm a sub-investigator on this study and I have hands-on experience with the drug, and I found it to be very well tolerated by my patients in the trial. The second piece of information that we learned was that the frequency of EZH2 mutations in the trial population was pretty similar to what had been reported in the literature. Again, about a fifth of patients have this mutation. We also learned that this drug is active. In follicular lymphoma, about 13 patients out of 13 patients were assessable for response, and 12 of those 13 patients responded to this agent, which is a response rate of over 90%, obviously with wide confidence intervals. But we also saw responses in the unmutated population, so 54 patients were evaluable for a response in the unmutated follicular lymphoma population, and 14 of those responded. This is an important finding because in the follicular lymphoma population it was a very heavily treated group, and so this particular population of patients is one in need, and what we're seeing here is emerging data that this well-tolerated drug may provide a treatment option, particularly for those with the EZH2 mutation. Thinking now about diffuse large B-cell lymphoma, again we found EZH2 mutation was relatively uncommon in that population. 5 of 17 patients who had the mutation responded to treatment. I have seen a response at my own site, again a very well tolerated drug. 18 of 119 patients who were wild type for EZH2 also responded to this agent. The most common side effect was thrombocytopenia, which occurred in 13% of patients. This was generally very mild. And so what we've seen here is the development of a rational targeted agent. It's really one of the first examples of targeted therapy in lymphoma. At the moment, most of our novel therapies target broad mechanisms rather than specific mutations. And so this is really one of the first examples of where we can assess a patient for the presence or absence of a mutation in lymphoma and then specifically target it. So it's very exciting, but there's more work to be done. We obviously need to see more patients with this mutation. We need to be able to bring screening for the mutation into the clinic and into the routine part of patient care. And I think what we're seeing here is the hint that this approach to targeted personalised medicine is feasible and that and active in this group of patients who need novel treatments. And I think the challenge for our community then, once we have the opportunity, is to test more of our patients for these mutations. Because I think one of the operational challenges for this study is to make sure that we know whether patients do or do not have this mutation, because on these early numbers, in these relatively low number of patients with the mutation, we're seeing quite high response rates. And so we need to test more patients to find more patients who may benefit from this agent. But all in all, a very exciting study, which I think was well deserving to be in the plenary session.